Good afternoon, and thank you for joining us today on the program Healthy Living. I'm Adisu Waltz, our guest. Today on Healthy Living, we want to look at your eyes, my eyes, every other person's eyes. What are those things we're doing to our eyes that are not right? Are there some myths about taking care of the eyes? There are so many things we do to these eyes that ought not to be, but it has been accepted either because of fashion or one thing or the other. And Dr. Roberta Oyibe is here with us. She is a senior registrar and an ophthalmologist from University of Benin Teaching Hospital. Doctor, pleasure to have you join us.
Thank you so much.
Yeah, you look good.
Thank you.
Our doctors usually this fine.
All
right, doctors, let's quickly go into what we have to talk about today, the eyes. Okay, the very first question I want to ask is, because we are Nigerians, because we are blacks, what are some of the common eye problems that can happen to a Nigerian?
Okay. There are many eye problems that can affect Nigerians.
Okay.
One of the commonest ones is glaucoma. We're at risk of having primary open angle glaucoma more than...
Primary angle.
Yes, the particular type of glaucoma.
Okay, so there are types?
Yes, there are different types. So this particular one is quite common in our environment. That is, this glaucoma affects the optic nerve of the eye, first of all. And when the pressure inside the eye is not well controlled, it's larger or more than usual, then the patient can actually have optic nerve damage. And when that happens, there can be insidious, gradual reduction in vision till vision is lost. Okay. It doesn't even give symptoms most times.
No yes, symptoms. This primary you can't even self-diagnose to say,
yes.
Oh, I think something is wrong with the eyes.
Yes. That's why it's very important to get early detection by coming for routine checkups. And it can even be inherited. So that's a very common condition. So we encourage family screenings, okay, in order to reduce the risk.
That's if there's a case in the family already.
Yes.
Regardless of how close or how distant that person may be to this person.
Direct relatives are at risk of developing glaucoma more than extended family members. So it's important that first-degree relatives have their eyes checked, because the risk of it occurring in the next generation is increased. So that's why we encourage early detection by going for screening, by having what they call fundoscopy done. It's a particular equipment we use to check the fundus, which is the back of the eye. And we look at the optic nerve head. And there are certain features we can detect when we look at the optic nerve to know, or if this patient is suspicious for glaucoma, then we do other investigations to confirm if it is really there. So it's important because it causes irreversible damage. So glaucoma is one of them. Then there is also cataract. Well, that is a global problem. It's not necessarily just associated with Nigerians.
Okay, let me take you back to glaucoma.
Yes.
You said it is not reversible. So what can be done? If it's not reversible, the person is just going to remain like that.
Sadly, the damage to the optic nerve is not something that can be cured or can be reversed. It's only something that can be halted. So that is why we encourage patients to present early, so that once it is detected, they can start treatment to prevent it from getting worse, thus preventing the risk of developing blindness.
Is surgery involved in all of this?
Yes.
When it comes
there
to
could
the
be surgery done, but that's not the only form of treatment. There could be medical therapy, laser therapy, and even surgery done. So it depends on the severity and the patient's preference. Okay,
so can somebody be born with it?
Oh yes. Glaucoma can be born, a child can be born with glaucoma. Yes, there is a genetic predisposition to developing glaucoma. So we have something as congenital glaucoma. It's quite an unfortunate situation. When that happens, the way it appears in children is quite different from the way it appears in adults. Because adult onset glaucoma usually occurs from the age of 40 years. But for children, when they are born with it, the eyes appear to be larger than usual, bluish in color. The white part appears bluish in color, and they have difficulty tolerating light, and there's lots of tearing. They blink a lot. That's what we call blepharospasms. Then they also have tearing and irritability to light, photophobia. So these are some of the features that one can see and know that, oh, this child has glaucoma.
You know, majority of Nigerians find it very difficult to go to the hospital when nothing seems not to be wrong with them. You know, before people present, most times you hear that it's already late, there's nothing to be done about it. Or maybe if they are lucky, palliative can be done to help them through. So how do we now encourage ourselves to go to the hospital for this regular checkup that you have talked about? Because nobody will say, what did they do my eye? Nothing. Just go away by yourself. Just go to any pharmacy or chemist, as the case may be, to complain to anybody you meet there, whether the person is a pharmacist or not. In as much as you're seeing somebody there wearing a lab coat and all of that, they say, beg, my eye, they itch me. Give me something to put. And truly, they give you something to put without a prescription. So how do we get ourselves to act, to be proactive when it comes to the issue of our eyes?
Creating awareness is one of them, like what we are doing now.
Okay.
We're talking about eye health, how important it is for people to get checked. So creating this awareness is a way of telling Nigerians to please do not just go to any chemist, because do not just use traditional eye medication. What are those? Using harmful medications, harmful practices like using urine. Some people use urine, breast milk, even leaf, cola nut water, sugar and salt, all manner of funny things when they have eye diseases or any eye complaints, rather than coming to the eye clinic for proper checkup. So creating this awareness, we're telling people that please do not put yourself at risk, because when you put those traditional medications, they can damage the eye and cause permanent blindness.
And people do it.
Yeah, and people do it. We've had lots of people come to the hospital when it's already beyond, remedy, unfortunately.
That's very sad.
Yes.
Okay, are there underlying ailments that can create eye problem for somebody?
Yes, there are systemic diseases that can create eye problems. Okay. In fact, and thankfully, the eye can actually reveal some of these conditions. That's why it's important to get the eyes checked, because the ophthalmologist might be the first person to even detect those conditions.
Okay.
Recently, a child presented with bleeding from the eyes. But it wasn't just from the eyes, from the nose as well. Bleeding. So I mean, just the mother just seeing blood coming out from the eye was worrisome. Only to discover that child had what they call viral hemorrhagic fever, one of those Lassa-related conditions. Of course, that child will need viral serology and other investigations. So when seeing that alone, that is a point at, okay, there's another problem, a bigger problem, a life-threatening problem. There's diabetes mellitus. It's a condition that involves having poor sugar control in the blood, okay? And it's an endocrinology disorder. So it can be detected in the eye because they are at risk of developing cataract early. They're at risk of developing stye, which is a kind of boil, like what we call like a swelling around the eyelid.
Around the eye.
Yes, okay. yes. They're at risk of developing what we call chalazions, also another kind of swelling. They're at risk of dry eye syndrome. So there are many other.
Is that one, dry eye syndrome?
When we say dry eye syndrome, paradoxically, it even means when a patient is having a lot of tearing from the eyes. Yes. There's lots of tearing from the eyes, there's lots of peppery sensation, a lot of grittiness. So they're at risk of that as well. So there are systemic conditions that can be detected. Sickle cell disease. You see some people, they have very yellow eyes. What we call yellow. That's where we say the conjunctiva is icteric. It's yellowish in color. Okay. So by just looking at them, you may even tell them to just go and get their genotype tested, because they may just have sickle cell disease.
So the eye reveals a lot.
Yes, the eye reveals a lot. Somebody having a red eye, just having a red eye may be a sign that the person has developed trauma. Wow. Maybe, but that's not, of course, that's not a systemic problem. Okay. But there are other conditions as well. There's also hypertensive retinopathy. Okay. Hypertensive retinopathy is when a patient that has elevated blood pressure for a prolonged time, now suffers damages to the retina of the eye. So it's very important that people get their eyes checked, because there are many conditions. There's thyroid eye disease, which is associated with an endocrinological problem called thyroid disease. Okay? So imagine those people present with proptosed eyes when it's very severe. Eyes proptosed, meaning the eyes are protruding outward. people, and sadly, it's even commoner in women than men.
You don't say.
Yes. And it's associated with a neck swelling in most conditions, a neck swelling. So just looking at the eyes can tell you a lot about a person.
All right, doctor, time is really not on our side. Let's do this in a minute. How do we take care of our eyes generally?
Oh, there are many ways. Okay, the first thing is our diet. It's important that we eat nutritional meals.
Oh, so food can affect the eyes
yes.
too. The way you eat can either bless or mar the eyes.
Yes.
Fantastic.
Yes.
Okay.
So it's important, of course, to reduce sugar intake because of the risk of developing diabetes. Okay, mellitus. And also, it's important to reduce excessive salt intake because there's a risk of developing systemic hypertension.
So you drop all the sweet things, salt, sugar.
Too much of everything.
It's truly bad.
Yes. Then there are certain meals, there are certain meals that is important to take. We have citrus fruits, and vegetables, citrus fruits like oranges, tangerine, grapefruits, berries.
We're in the season right now.
Yes. There's the blueberries, the strawberries, but of course
those
ones are not. Okay, but
those ones are out of it, but at least we can do citrus.
We can do vegetables, ugu leaf, bitter leaf, spinaches, broccoli, carrots. Yes, they help.
And these ones you mentioned are quite cheap. They are affordable.
Nuts, walnuts. Walnuts is also rich, and good for the eyes, nourishing to the eyes. Okay, then
what about peanuts? You didn't mention that.
Okay, well, it's a kind of nut, so of course that can work.
Okay, that can work.
Well, but walnuts.
Some of us like that, so we need to ask.
Yes.
Okay.
Yes. So there's also it's very important to exercise. Because reducing all the systemic problems can also protect your eyes.
Okay.
It's advisable to exercise about 150 minutes in a week. That's maybe 30 minutes per day in 5 days in a week. So that's important too. Quitting smoking for those who smoke.
Okay.
There are eye conditions that can be exacerbated or worsened by smoking. Thyroid eye disease, age-related macular degeneration is also one of them. Protecting the eyes, like using glasses, blue coats to protect your eyes from ultraviolet rays, can protect your eyes from eye cancers, pterygium, and other eye conditions.
All right, I did say that when Dr. Yube comes, she's going to tell us quite a number of things on how to take care of our eyes, and she has just done all of that. So we're going to do this again very soon, and hopefully Dr. Yube will be available to do that for us. There won't be emergencies anywhere, okay? So thank you, Doctor, for finding time to be with us out of your very busy schedule.
Thank you very much.
Thank you so much. We appreciate it.
Thank you, Ma.
All right, guys, we'll see you again next week. Until then, please, your eye well, take care of it. Bye-bye.